In this episode, I'm sitting down with Beth Walley, who is the Executive Director of the Division of Family Practice for the Central Okanagan. We explore what primary care looks like in our community and how it's evolving, what's working well, and what are the opportunities to grow and evolve to serve the emerging needs of our communities in this region. You're going to want to listen up. When we talk about healthcare, we often think about hospitals or emergency rooms. But for most of us, our health journey begins somewhere much closer to home. Primary care. That first checkup, the ongoing support, the relationships we build with our care providers over time, that's what helps keep us well. And while it's no secret that healthcare is changing across Canada, today's conversation isn't about what's broken. It's about how primary care is evolving, what that means for people here in the Central Okanagan, and where connection, creativity, and collaboration are showing up in new and inspiring ways. We also want to take a moment to acknowledge the heart of primary care, our family doctors. Their dedication, compassion, and commitment to patients, especially in times of transition, deserve our deep respect and understanding. Joining me today is Beth Walley, Executive Director of the Central Okanagan Division of Family Practice. The division plays a quiet but essential role in our health system, supporting local family doctors, advocating for stronger connections between patients and providers, and helping to shape more sustainable, community-centered models of care. Because when we support the people who care for us, we build a system that can truly care for everyone. Whew. Boy, I really knocked it out of the park with that intro. Welcome to the Wealthy Podcast, Beth.
Thank you so much. I'm very excited to be here.
Yeah, it's so great to have you. And this is a conversation that I have been looking forward to for some time because this is a topic that I think it's safe to say impacts everyone.
Oh, yeah. I mean, healthcare is primary care.
Totally.
So
yeah.
Excited to talk more about it.
Yeah. And I'm excited to unpack it with you because you're definitely the person to talk to about this. But on the Wealthy Podcast, we have an opening tradition and you are not exempt. I am just curious how your interest in healthcare, primary care, kind of like working to advance healthcare in our communities. Where did that all start? Like, where did your interest in healthcare begin?
Yeah, I wish I had like a really amazing come to Jesus story about this, but it was a slow burn evolution. When I went to university, I always knew I wanted to be a social worker. That was like a passion of mine. But social work is such an open-ended field, and it's not healthcare specific. And so my first job, I kind of stumbled into a job as a casual social worker in the health authority. And I worked in Alberta at the time. But I really found like excitement doing the work. So I started off as a frontline social worker in home care, working with a population of underhoused men with addictions issues. And did that for about 5 years and just loved it. Realized I can do something, like I can be helpful.
Mm-hmm.
And then from there, I realized I want to help more than just individuals. I want to create change in systems. So I ended up taking a leadership role, developing education curriculum for other healthcare providers. And then they're kind of spiraled into more leadership work. And now looking back, I didn't mean to end up here, but I'm so grateful that I did. And I dabbled, I worked in acute care for about 18 months right before we left Alberta in 2020 and realized acute care is not for me. My real heart is in community and primary care. And that's where I feel like I have the most knowledge and the best impact for whatever community I'm living in.
Mm-hmm. So tell me about, I'm going to double click a little bit on this one because I kind of want to rewind a little bit further. Tell me about little Beth and why social work, why sort of this helping profession.
So in 6th grade, we took aptitude tests.
Oh, no way.
I grew up in the States. So this was I remember I got the results back and it was like a very clear delineation, like you're going to do something that requires rage. So,
really?
Yeah, it was like,
no way.
I was going to be a professional boxer, a lawyer, or a social worker. And I talked to my mom about that and she's like, yeah, that pans out. Like that seems right. And like I said, we grew up in the States. And at that time, going to the doctor was kind of like a decision point because every time we went, it would be like, are you really sick enough to have to go? Because we have to copay if we go to the doctor.
Oh, right.
So
okay.
It was,
so you mean at home? Like the conversation was like,
at home.
Really?
Like so we were from I had 4 siblings. I'm one of 4 siblings. So the 6 of us would have this conversation of like, do you think we could all go and get a good bang for buck if we get there? Could we all get a strep test, or is it just you?
Right. Like, or if all 4 of you are sick, maybe just take one.
Yeah, right.
Hopefully it's the same thing.
Yeah, so we would just get the meds for everybody, split them up. So when we moved to Canada when I was 12, it was this kind of aha moment that like, oh, you don't have to pay to go to the doctor. Like that you can just go to a doctor and you have a doctor to go to. It's not like a clinic that they determine whether or not you're eligible to see a doctor.
Interesting.
And so it was a really great moment for me that I was like, oh, I like this. Like, this seems just.
Right.
This is a just way to provide healthcare.
Yeah.
And so I think my whole life I've wanted to kind of change the systems that I work in. And I always felt there's injustice for people that can't speak for themselves. And I'm in a very lucky and privileged position to be someone who can speak for others. And I take that to heart.
I just met you in real life. We've had a couple of conversations over Zoom or Teams, and it's so interesting. You're like such a warm and effervescent personality. I'm not sure if that's translating in the audio or the video, but I'm going to tell people. So I gather like you really do love people. Like it seems to me. Like, is that accurate?
Yeah, most people.
Yeah,
Fair. I really do. I feel like healthcare. What would be the purpose of working in healthcare if you didn't care about people? And throughout my career, I've always worked in healthcare. Like from my first day working in professional care, it was in healthcare, and I haven't met anyone that I've worked with who also doesn't love people. Like people are here altruistically to care for others.
Right.
If they were here for dollars, they'd be doing it somewhere else. And I think healthcare without love really isn't caring. It's
it's not care.
So I really feel that like loving people is the underlying reason that I'm here.
Wow. I absolutely love that we're opening from that place.
Great.
Just basic housekeeping, Beth. Who do you think is going to get the most value out of this episode?
Oh, that's so interesting. So I was joking. I was talking to my partner in preparation for this, and he works in sales. And even as we were kind of going through, he's like, oh, I didn't know that. So I hope that there's little pearls that people didn't know about primary care. But I also recognize that like I am probably a pretty good example of a key demographic. So when I'm thinking of the me on the other side, I'm also hoping to talk to people about what can we do to be impactful to the primary care system from the lens of people accessing it and from the lens of people providing it.
Totally. And that's one of our goals with this podcast, is to not only just sort of like pull back the curtain and shed some light on some of these things that are being talked about in other areas and, media, and provide a little bit more color to these narratives and these stories about primary care and doctors and the role that they play and some of the challenges we're facing in Canada, but also to empower our audiences as well with like the opportunity for them to participate, like to not just be like, this is the one thing, like, having worked in healthcare for almost a decade and like also being a patient, like, how can we empower people to be part of this conversation? It's not just like the caregivers holding all of the information and the power, but like the power that people have, the community has to be part of it. So, okay, so let's zoom out. I want to start with some definitions because I want people to understand what we're talking about. First of all, like, what is the division of family practice and what is its purpose? So you're the executive director. What types of services or support does the division provide to doctors and like our broader health system?
Absolutely. So first of all, I think the division is something that's unique in British Columbia. There are other provinces that have something like this, but it isn't a standard part of care. But the division is a not-for-profit cooperative. There's 37 in our province. We're one that represents the central Okanagan. We are funded. So
37 divisions of family practice in British Columbia.
In British Columbia.
Okay.
Yeah. So we are one of 37.
Okay.
Each one is its own separate entity. And we are funded through something called the Physician Master Agreement, which is negotiated by the Ministry of Health and Doctors of BC. So we get funding through that collaborative efforts between the ministry and Doctors of BC to do some pretty standard work, and then also get funding to do what's needed locally for our own communities. So some of the things that we are required to do is we support retention, recruitment, and retirement for family physicians.
Okay.
Family physicians are our members.
Okay.
And so those are the people that we serve. We support attachment through the Health Connect registry, which is the provincial attachment database that you and I could register for a family provider on this wait list. The division then manages the administration of that wait list. I see.
So when somebody's looking for a family doctor and they go in and they put in, like, fill out the form or whatever, you guys manage that.
We are the connecting between the patients and the providers. We also do a lot with business supports for family physicians. So most physicians don't graduate med school being really great at business.
Entrepreneurs.
Right. They're really great at medicine. So owning a business, setting up a clinical practice, hiring staff, being an employer, those are things that we can help family physicians do and connect through peer support. So I think the biggest and most emerging thing that we do is we actually take physicians within the community and help them develop peer supports for other physicians in the community. So it is a physician-led initiative where people can talk to peers, network with peers, and engage with each other. Because there's so many people at different life phases that can benefit from other people's knowledge or experience.
And by people, you mean like family doctors, right?
Yeah.
So yeah, for sure.
And so I think the big key cornerstone of what we do is that we are the voice for family physicians at tables where they typically don't sit. So we partner with Interior Health, with the Ministry of Health, with Doctors of BC to make sure that the local voice of family physicians is understood, or maybe local issues are understood. I'm very proud of the work we've done within our interior region because we have phenomenal working relationships with our partners. The people that we get to work with every day are equally as passionate and committed to improving things. And it just makes the work so much easier when you have people that you trust on all the different tables that we're sitting at.
Totally. I think it's worth pointing out, or just unpacking a little bit, acknowledging that family doctors are not paid by the health authority, right? They're independent contractors.
That's right. So if you're thinking of your traditional family physician, you go to their office, they are an independent contractor that is paid through models of care that the Ministry of Health has set up. So in 2021, one of the best initiatives that the BC government has done is released a new model of care payment called the Longitudinal Family Practice, or LFP model. And not only did it help retain people that might have retired, but it actually was a huge influx of family physicians who moved to British Columbia to use this payment model. It simplified things. It allowed physicians to spend time doing things like clinical reviews and paperwork that they typically have done always, but now they were recognized for the work they're doing. And it allowed for more relational time with patients. So it really has helped over the last 3 years change the landscape of family physicians and actually shore up some supports that weren't there before. And in our region, most physicians are in that compensation model.
Yes, I have a few friends that are family doctors, and they've spoken very highly of that. What do you call it? A model? Because, and we can sort of get into some of the, pressing issues that we've been facing in recent years, just with regards to primary care and family doctors. It's no secret. There's been challenges there, but this initiative, what do you call it? The
LFP, or longitudinal family practice model.
Yeah, has been, I think it's safe to say, a game changer.
Yeah, absolutely.
Yeah. And keeping physicians here and acknowledging and recognizing all of the work that they're doing on our primary front line.
That's right.
Yeah. Love it. Okay, so then that leads kind of to my next question. What is, I really want us to be clear about what we're talking about. What is primary care?
Yes.
And why is it such a foundational part of our health system in Canada?
So,
or anywhere, I guess.
Yeah, primary care exists everywhere. And I think most of us access care through primary care without thinking about it. So if healthcare was a building, primary care is your door to get in. Most people aren't going through windows to get into healthcare. They're going through the front door. And so primary care is your front door. The Canadian Institute of Health Information has this stat that's been pretty consistent over time, that about 83% of healthcare starts in primary care. That is how most of us will experience healthcare.
Right.
So I think of myself. So I'm a 41-year-old woman with a toddler and a partner. And our family is pretty healthy. And so when we need healthcare, it's because, we've got a daycare cold that's turned into a lung infection. Well, how do I get care? I go to my family doctor. And that is, to date, the way I've access to healthcare is in primary care. Now, if you have more needs, the goal of primary care is that is the way to spiderweb to the rest of the services. So they can connect to specialists, they can connect to allied health, they can connect to nursing supports. But your family physician and you, that dyad, remains like the nucleus of the healthcare system. So even as people go in and out of hospital or receive specialty treatments, the boomerang goes back to your doctor.
Right. And
so that the importance of care, and when you talk to a family doctor, that you hear terms like birth to death, the cradle to the grave. That family physicians are trained to care for everything for the whole life spectrum. Kelowna is so interesting because I had a colleague younger than me that her family physician was the same person that delivered her.
Wow.
And I was like, when does that happen anymore?
I know.
And that same family physician was also caring for her grandma in long-term care. So she was doing everything. And I think that idea of this longitudinal, this lifetime care, people don't realize the impact that has on the person doing it, and the potentially moral distress that comes when the system becomes so heavy with care too.
Yes.
But primary care, that relationship between patient and doctor, is such a pivotal point of accessing all healthcare.
And I think that's really valuable to point out, is that is our entry point into the healthcare system predominantly, like you said, 83%. And that the relational aspect, the relationship between the doctor and, I don't want to say patient. Do you call them patient?
Oh, it depends on who you talk to.
Yeah. Okay.
It's like friends is some.
Sure.
Clients, patients. It's
yeah. But that is it's a pretty important relationship. And so again, being able to facilitate good relationships, like you mentioned moral injury. We've had a couple of guests on this podcast talk about that. We won't get too far into it, but it's really important to kind of protect our the well-being of our family physicians as well, right? So you've kind of outlined what longitudinal care means, and why it's important for overall patient health and well-being. I actually kind of want to talk about your background in social work.
Sure.
Though I think that's really interesting. So what ways does primary care intersect with we've been talking also about social determinants of health, housing, income, food security. Maybe you can kind of shed some light on that.
Yeah. So, I mean, So when I think of what is my interest, it's because I care a lot about social determinants of health. But when you look at social determinants of health, things like housing security, food security, health literacy, access to education, all of these things. When you have a high level of health in those areas, you tend to have a high level of physical health.
Right. Mm-hmm.
So when family physicians and nurse practitioners are seeing patients with low physical health, chances are their social
there's
determinants
something
have been
else too
compromised in some way. And so it's almost impossible to extricate the two from each other. And I think where family physicians are so well trained is to see this as an intertwined, like the Maslow's hierarchy is in fact how you assess for care. Is
really
you really can't start just assessing someone for antibiotics for a wound if they don't have a way to change their dressings.
Yeah.
So that full assessment of like what matters to this person's ability to stay functional in their life is the underpinning of how family physicians have to operate to be successful. And that's where I think the traditional models have changed so drastically. So, and when I say traditional, I think back to, like in your Dick and Jane books, and you say, you went to the doctor. That isn't the way healthcare is provided anymore, because our lives have become more complex. Our healthcare has become more complex. Diagnostics has become more technology. And so family physicians have to be so nimble to understand the impacts that people live with every day. Like this is people's lives. This isn't, a one-day acute injury. This is a lifetime.
Or a specialized injury.
Yeah, exactly.
Right? Or ailment.
Yeah. So that full assessment of like, who is this person? What matters to this person is also how they have to move forward with diagnostics and treatment and care. So that relationship is such a key component.
Yeah, it's very interesting. And I'm sure that your background really helps you, certainly in supporting family doctors in kind of like those aspects that I think we take for granted. Like I don't, I know I have a good relationship with my family doctor. And she always asks me like so many questions. And I'm like, oh, I don't even really think about those questions, but now understanding that they're trying to sort of put this into the context of the bigger frame of my overall health,
of course,
which includes obviously my physical health, but relationships and what's going on in my life and stress and sleep and all of the rest of it. Right?
Absolutely.
Yeah, very interesting. So to that regard, can you kind of like outline the role of primary care in prevention?
So,
because we don't really think about healthcare for the most part that way, although we're trying.
Well, and if we did as a society, it could change how healthcare is provided.
Totally.
Too. So what I'll actually start by talking about is an initiative that started in the Okanagan in 2020. This is why we moved here. So we were living in Alberta. I got hired by the division to help start the primary care network in our region. And so the primary care network is a collaborative between family physicians and the Division of Family Practice, the Health Authority, and First Nation partners. And the purpose is to provide like preventative support and to ensure that physicians receive support to provide patients care in a team-based environment. So the primary care network in our region, most family physicians who are eligible participate. And what we do is we hire clinical staff like nurses, social workers, occupational therapists, physiotherapists, psychologists, dietitians to work with family physicians.
Interesting.
So your family physician, if you and I are going to see, and I'll use myself as an example, is after I gave birth to my little girl, my postpartum care was almost done predominantly by the nurse attached to my primary care provider. So she was the one that did breastfeeding support with me and helped with safe sleeping at night and ensured that like my baby was gaining weight, and she worked with public health to make sure that this was done. And so all of that could be done by my doctor, but it didn't have to be. Right. And now my doctor had time to do higher volume, more acute, more specialized care, and has a team of healthcare professionals that can provide more in-depth counseling, more face-to-face time with patients, more education around prevention, promotion, chronic disease management. And so what you're seeing with this emerging model is a change in both volume that physicians can manage and quality of care that patients are seeing. So with that primary care model in the Okanagan, the idea of prevention is one that seems more reasonable to approach because you have a better cohort of it or a team to actually provide it to patients.
Right.
It feels like it's the best kept secret.
Totally.
In primary
I didn't even know
healthcare.
this was a thing.
That's right. And,
yeah.
And when I talk to like my neighbors, they're like, what are you talking about? Because it takes such a long time to change the way that we provide care, the way that
model
that patients expect care to be provided. So I would say primary care networks have existed in other provinces for 20 years. In BC, it's been about 7. So we got time to socialize this.
yeah.
But it will change the way primary care is provided, and it will allow us to be more focused on preventative care and chronic disease management and in a team-based way.
It's so interesting. I totally had no idea that existed. And sort of like the anchoring premise of this podcast is that health is wealth, and that we're not just talking about sort of physical health. And you mentioned that, you've got nutritionists and psychologists, and like this primary care network isn't just reserved for sort of frontline family doctors, but it's like an entire network.
Well, that's the goal. So, I mean, it's still new, right?
Oh, okay.
Again, we established in 2020, we just finished hiring like the actual resources this year.
Yeah.
And now it's funny, the director of the program and I met the other day, and we're like, now we focus on the network.
Yeah.
Like it's the pieces are in place, and now we have to connect them together.
Yeah.
So partnering with like CMHA and the YMCA and Thrive Okanagan, like these are the ways that care actually starts happening. Like I am a strong believer that healthcare actually happens outside of healthcare settings. Healthcare happens in your backyard barbecues with your friends and talking to your colleagues about their own well-being. Like that's healthcare. And so when you can move preventative model back to the community and to individuals to be responsible and active in that, like that's where things get better.
Totally. So obviously there has to be data or research that shows that a more integrated and preventative based model of primary care is going to be more beneficial.
Totally. Yes.
Yeah. And I'm just curious, like, maybe you don't know, but if you do have any sort of anecdotal evidence of how the mental well-being of communities is impacted by a strong primary care support network.
Yeah, so our PCN, primary care network, we do lots of evaluation with like those who are accessing service, and then we get a lot of feedback back from people who've like experienced this for the first time. And there's been a handful of comments that we've gotten back from patients that said like, the dietitian saved my life. Like I didn't know this stuff before. But we also get feedback from physicians that say, this has saved my sanity. Like I have time to do my work because I have a team to support me.
Right.
And, I was talking to one of our physicians last night that said, I don't know how to access some of this stuff, but I don't worry about it anymore because the nurse does.
Yes.
Like I can just tell the nurse, this is the issue the person's facing. And I trust that they're going to do it because they've always been able to. So I think it creates, systems exist because people trust each other, and people trust each other because the system exists.
Yeah.
So it's this constant process of ensuring the good people in the system are becoming trustworthy, and the system can grow because of that.
Totally. Yeah. And like generalist care is like, it's just like generalist anything, I mean, my area of expertise is, marketing communications. Generalist marketing communications is extremely difficult.
Yes.
So I can only imagine for primary care providers and family doctors, like general, like to have that breadth of knowledge on all of the things
That's right.
would be completely overwhelming.
Yeah, absolutely.
Yeah. And so being able to lean into the expertise or the skill sets of others who might have a little bit more specialized knowledge, let's say a nurse practitioner, dietitian, nutritionist, whatever, can help relieve that burden from the family physician.
Yes.
So that you can be more relational.
Absolutely.
Right. Which is, I think, a benefit for all of us. And I love that. I'm sure it was exciting for you to come in at the ground level for that.
It was. I mean, when we moved here, like I had no idea what the division was because it didn't exist in Alberta.
Yeah.
And so I just think how I'm so grateful that I got lucky to fall into this position because this is what I care about. Like I've always wanted to change the community around me to be healthier, to be happier, to be more secure. And what a privilege to be in a position that this is actually what I get paid to do. Like it's pretty great.
And I'm so happy to have you here, like in real life, talking about this because like you can tell, like I can tell that you're passionate about this and that you really do care. And I think one of the things that we've heard over and over again from sort of like mass media or some of the, you know, like common narratives about primary care is that like that we don't know that there's a problem or, you know, that we're not addressing the problems, but we are actually. And there's people on the inside that really care a whole lot.
That's right. Yeah.
About making the system better.
Yeah.
But it just takes time. Right. But it's not that we don't know the answers.
That's right.
You know?
And I think that people like family physicians are stoic. They will continue to do work to their own detriment.
Yeah. Capacity. Yeah.
And I think that's the other thing is that the crisis of health human resource, which is like a global crisis, it's hard to see that because it's on the backs of people that just keep giving more.
Yeah. Yeah. And I think, and you know what, this comes up over and over again. It's like, we have to maybe start to separate, just like everybody start to separate in our minds the difference between system flaws and system challenges and people flaws and people challenge. You know what I mean? Because like over and over again, we hear like all of these challenges that the system is facing. Yeah. And those are complex challenges and they take time to figure out. Right. But the people are amazing. Yeah.
Do you know Elaine Alec? She's a silk storyteller and author.
No.
She has this phrase and she says it often. She says, be soft on people and hard on systems. And I see that is my job. And that's the job of the division. Like we work really closely with people, and everyone I've met in every system that I work with cares. Like I linked arms with people who are doing the same work. And as a citizen of Kelowna, someone who votes and accesses healthcare, it is my responsibility to do something to adjust the system. Like that is all of our responsibilities to work to improve things for our community and for those around us. And the people working in it, I guarantee are doing it sometimes silently, sometimes loudly, but always consistently. And so it might feel bleak at times, I think, for people who've had bad experiences in healthcare. But I have a sense of hope that even in the bleakest times, like in the middle of COVID, when everything felt hopeless, there were still people doing the work. There were still people providing excellence in care. And that's how we got to the other side of it. So I am confident that regardless of the crisis, we continue to rise above it.
Yeah. And I think you and I are lucky because we get to live and breathe that every single day. But I appreciate you sharing these stories and the perspectives of the people that are on the front lines of care. Because sometimes those are the stories that get lost in these bigger stories around the challenges that we're facing in healthcare in Canada. So I'm going to kind of just go there. So as you've mentioned, universally across Canada, more and more people are finding it difficult to access primary care. We know there's a shortage of family physicians. National data shows that about 1 in 6 adults don't have a regular family doctor. And even here in the central Okanagan, it's no secret we've been experiencing that pressure as well. Some good changes have happened in the last year. But it's not about, as you said, like pointing fingers necessarily. It's about understanding the complexity and working together towards sustainable solutions. But maybe you can kind of peel back the onion a little bit and help us understand what are some of the root causes contributing to the current strain on primary care, not just here in the Central Okanagan, but like nationally.
Yeah. So our region, Central Okanagan, so when I say that, it's from Peachland to Lake Country and everything in between. We're always doing slightly better than everywhere else because people like living
That's good
here.
news.
Like, what a great place to live. So even when things feel bleak here, I have to remind myself like that we're actually like this will be sustainable.
Right.
But the Central Okanagan did not have an issue attaching patients until 2021. Like that was the first time we ever ran a wait list for anything.
Right. And when you say attaching patients, you mean finding a family doctor?
Yeah.
Okay.
So if when I moved here, I got a doctor. There was no issue. There was no wait list. There was an ability for patients to find it. And so I use words like attachment. What attachment means is that a person, a citizen, and a physician know that they are mutually linked, that they would both be able to say, that's my doctor, that's my patient. And family physicians have things called panels. So that's the people that are attached to them. And an average family physician has somewhere between 1,000 and 3,000 patients that they're responsible for on their panel.
Okay.
So up until 2021, there was no wait list. And then many things happened. The post-COVID retirements started. Right. And that was, as you said, globally. And the general movement of people in BC started. And so when people had the ability to start working virtually, where else would you want to live other than our beautiful region?
Yeah, my husband sells real estate. It was bonkers. Yeah. Everybody wanted to move here.
So when you're moving here, what are the three things you care about? Can I get a house? Can I get childcare? Can I get a doctor? And overnight, we went from 0 people on our wait list to like 5,000.
Really?
It was like almost instant. And at that time, there was no provincial system set up. It was just in the making. So we launched the Health Connect Registry, which is the provincial database where patients can self-register to find a family doctor anywhere in the province. And I highly encourage anyone who doesn't have a doctor to register on
and we'll put
HCR.
a link to that in the show notes.
So our region went live with that wait list in July 2024, so just last year. When we went live, so we spent quite a few months just making sure people were aware and were registered on the wait list. When we went live, we had 12,000 patients registered to find a family doctor.
Wow. And that's just in the Central Okanagan?
So people, and you can register. You don't have to live in our community to register here. You can be moving here.
Got it.
But you do have to have an active MSP number.
Okay.
Since July, we've attached 6,000, which is huge numbers. That's half the wait list in a year. But our wait list has remained at 12. So that means that we are having people come in as fast as we can
quickly
attach.
as you're attaching them. Wow.
So when I say we're in an okay situation, I recognize that there are people that will be listening to that can't access a family physician, that can't access primary care, that are overwhelmingly frustrated with, like, if we know that's your entry point to healthcare and they can't get in the front door, how
what else
disempowering
do you do?
that
Where's the
feel.
window? Yeah.
So we also, Interior Health has 3 urgent and primary care clinics. Walk-in, there's a number of walk-in clinics. And so those are the way that people without a family physician can access care. But we also know that has its own dysregulation because of, you have to keep going back and wait times are long and everything else. So our goal is, and when you talk to our Minister of Health, it's that every person in BC has access to a doctor. But we're not going to recruit our way out of this. Like the numbers, the math alone won't allow for just hire more doctors. Like that's not the answer.
Right. Yeah.
So we have to paradigm shift and say if that's how we've always done it and it's not going to work, like it's a simple math problem, what are we going to do different? And so there's a few things. The primary care network is one option. It's changing the way care is provided to be a team-based model. So if I go to my doctor, perhaps I don't need to see a doctor. Perhaps I'm better suited to see a physiotherapist or a nurse. because my care can be provided there, or 90% of it can, and the physician can jump in and write the right prescription or whatever it is.
Order a scan.
Mm-hmm. It's also the reliance on community pharmacists and pharmacists within the primary care network who have actually a huge scope of practice to do so much of this work. But what that means is that citizens like myself need to be knowledgeable and understand and properly and equitably use the healthcare system.
Yeah.
So it's putting a lot of pressure back on patients to be knowledgeable enough to do it well.
Mm-hmm.
And so that's where I think the division has a role to play, is to help patients understand how to navigate this. It also means that the time I do get with my doctor, and most of us know it's less than 10 minutes, has to be used wisely.
Right.
Like I need to know he's got 10 minutes. So when he has 10 minutes, what can I do with that?
Mm-hmm.
What can I come prepared with? And how can I have my own healthcare prepared? And without fail, when I go in, I'm like, I know you're busy. And he's like, I'm never too busy. I've got time for you. He doesn't rush me through. But I know.
Because you know how it works. Yeah.
And so I need to be as respectful of that too. And so this dyad relationship, because primary care is so important for this provider and patient to do it well together, there has to be mutual respect to say your provider is coming to the table to do the best they can for you every day, and you have to do the same for them. Right. So I think it's, that's one of the pearls I'm hoping to take away, is the responsibility of like people like me to be prepared to use healthcare well, and then to know how to access other things if I can't get in mm-hmm. exactly at the time that I want to. Mm-hmm. Like, how can I talk to my community pharmacist? How can I how can I ask, like, do you have a nurse that I could talk to in your office? Is there someone else that I could speak to today?
And so for people that are listening right now, I love this. It's like super practical information. If you, can you just go up? I mean, I love my pharmacist. Mm-hmm. I've never thought to ask her, like, hey, can you help me with this?
Yeah.
Like, is that how it works?
Most community pharmacists can do a tremendous amount of things.
Yeah. And they're so helpful. Mm-hmm. Yeah. So that's the process.
Yeah. Just go talk to them.
Yeah.
Like a lot of our community pharmacists will even help with reordering medication. So it depends on, each pharmacist and their scope of practice, but they can at least inform and educate in the process. If they mm-hmm. can't, they'll tell you, but they'll help navigate you to where you can go or how you can access that.
Amazing.
Yeah. So we had ear infections the other day, and I thought, I know I'm not going to get it. Like it'll take 2 days. I'm going to go talk to our community pharmacist.
Okay.
Went and talked to our community pharmacist who navigated that and was able to get my daughter help.
Whatever she needs. Yeah.
So, it seems unconventional, but in fact, that is one of the key ways that you can start advocating. And when you talk to family physicians, community pharmacists have a pipeline to their physicians. So they're not doing it without engaging. And that nucleus of having your provider and your patient still at the center is still a key component to that. But looking at that as like
a team.
A team and circles of care of who you can also involve.
And I think, I have the opportunity to work with my colleagues at Interior Health. And this is one of the biggest, it's funny because we were talking, I'm so happy you're here because we can help provide some of this really sort of tactical information mm-hmm. for people. But one of the biggest challenges we all have right now in healthcare communications is like gone are the days of mass media where mm-hmm. you can just put an ad on the radio and tell people this is where you go when you have this problem, or, mm-hmm. We can't do that anymore because communications and media is so fragmented. Mm-hmm. Right. Mm-hmm. And so like basically giving people the tools and the awareness that they of where to go and for what mm-hmm. is really hard
it's so
for
hard.
The healthcare system. Mm-hmm. And we get it. Like, I was just talking to a colleague this morning. She was saying, like, how do we get the word out so people know where they can go for care mm-hmm. so that they don't feel like they're like withering in the wind?
Yeah.
And to your point, there are other entry points mm-hmm. that work in tandem or as part of an integrated sort of health team.
That's right. Yeah.
With your family physician. Mm-hmm. So the pharmacist is one.
Yep.
And you mentioned nurse practitioners. Like, are they working in physician offices?
Yeah. So nurse practitioners is a,
like, what are they first of all?
What are nurse practitioners?
Yeah.
So nurse practitioners are registered nurses that have advanced training to be prescribers and diagnose, like they can diagnose. So they are primary care providers as well. They have attached patients. They are is similar in many ways to family physicians, but their scope of practice and training is from a nursing perspective, and family physicians is from a MD, medical doctor perspective. So the theory behind how they provide care is different, but for you and I, the reason we would go to them may be the same. So if I am, you think of the main reasons you go to your family physician, chances are your nurse practitioner would be able to.
Okay.
To do
So
that.
like, this hurts. I don't feel well. I've got something weird growing on me.
Yeah.
Like,
Those
are the things.
Those are the things. And those are the main reasons people go to doctors.
Okay.
So your nurse practitioners can do that. Within primary care, there's many different ways that nurse practitioners work. They work in urgent and primary care centers and group contracts. They work in independent contracts within family physician offices. And then there are some that do group longitudinal care contracts as well, where they would like maybe 2 or 3 physicians or 2 or 3 nurse practitioners would hold a panel of patients.
Oh, okay. Okay.
So most likely you'll run into a nurse practitioner at a hospital or at an urgent care center, but there are a number of nurse practitioners who have contracts within like a family practice office.
And is the goal then, I guess, maybe in terms of a primary care network to integrate more nurse practitioners into doctor's offices?
That's right. So that was one of the initiatives within the last 4 years, is increasing the number of nurse practitioners in the community. And then the other piece is that we've hired 40 nurses, I think, for 40 patient medical homes.
Wow.
So if you think a patient medical home or a family physician office, there's about 60 in the community and 40 of them have a nurse attached. Like, that's amazing.
Yeah.
So chances are you probably may have, if you're seeing someone in one of those clinics, you have access to an RN and you might not know it. So you can even ask. The medical office assistant or MOA is also your best friend. Like,
yes, be nice to them.
Please be nice to them. They have a very difficult job.
Totally.
And they are a powerhouse of information.
Yeah.
They can help with that navigation and wayfinding as well. And so when you call and ask, like, do you have a nurse? Can I speak to the nurse? Like, they can help with that too.
Right. Amazing. Okay. I'm going to ask the question that I know everybody wants me to ask you. Tell me why only 10 minutes and 1 ailment per visit.
Yes. So thinking of an average family physician that has a panel of, let's say, 1,500 patients, that means that they have to see about 40 or 50 people a day to maintain health for the people that are attached to them. So if they're seeing 50 is the max, I would say an average family physician sees somewhere between like 30 and 40 a day. That means their visits have to be under 10 minutes to see that volume within a workday. And if they go longer, that less people that get care.
Right.
And so when they say 1 ailment to visit, it's because they can't assess 6 things in 10 minutes.
Right.
And if you're going to do your job well, you might as well do it appropriately and well. So some, not all docs have that hard limit of 1 ailment per visit, but most do. And talking to family physicians, they would rather you come in often and for things as needed rather than save them all up.
Right.
and do a once in 10-year visit, because they have to see another 30 people like you that day too.
Right.
So it's always at this cost of, is it volume, and how do you do volume and quality at the same time? And so to do that, you have to put some sort of boundaries to your work to be able to keep high quality work and high volume work happening at the same time.
Yeah. And I do think, like, one of the things that we talk about in terms of being a good patient is being efficient and doing a little bit of legwork before you go and see your physician. So if it is something weird growing on you or whatever, my husband has a new mole on his back. I'm like, you need to go see the doctor about that kind of thing. Right. But just doing a little bit of our own due diligence and research. And I know everybody says don't do Dr. Google, but at the same time, there's actually a lot of really good information available out there now, so that when we do end up having that appointment with our doctor, that we can be efficient too with our time. Like, sometimes also I'm amazed because I work in healthcare and I should know better. I'll get into the doctor's office. She'll start asking me these things. I'm like, I have to think about that.
Yeah.
Right. It's like, when did this start showing up? How long have you been experiencing this? What is the pain level? Like, so maybe trying to anticipate some of those questions in advance, write down the answers so that you have.
I like to give myself a 10-minute pep talk before I go in. And I'm like, what do I want them to know? Like, what's my elevator pitch about the reason that I need to be here? And then what do I know about the reason I need to be here? Like, is this new? Has this happened before? Do I have a family history? Is there something that, have I ever talked to my mom about something similar that she's experienced?
Right.
Like, what do
family
I know
history,
about the reason I'm coming in? Because chances are my physician needs to know that as well.
Yeah. Yeah.
So, I recognize my health literacy is much higher because of the work that I'm in than other people. But my encouragement to people is take 10 minutes and think about what it is that you want to say. And then think about what questions might be asked to help the physician understand the situation you're in.
Totally. Really great practical advice. Oh my gosh. Can you believe we're almost like at time?
I
like
know.
It's crazy. Look at this. Still have all these things. So I'm going to sort of switch gears a little bit. Because you said something earlier about, there's lots of bright spots and hope. And, I think that actually this conversation's been really great because you've shared a lot of really great examples of how there is hope and how the people working on the inside of our health system really do care and working hard to try to make things better, even if it just is in small increments. I just want to know, like, in your work, what keeps you inspired? Like, working in healthcare, some days you're just like, but like, what keeps you going?
Yeah. So I get to work with some of the smartest and kindest people, and that is inspirational. And because they're both kind and smart, their ability to problem solve and be creative is beyond what I could imagine healthcare could look like. So one of the stories that springs to mind is in recent memory, we had fires where long-term care sites were evacuated. And
right.
Many people might not know that people in long-term care sites are cared for by family physicians in the community.
Yes.
So we have a physician who we work with closely who is smart, creative, and kind. And one of the long-term care sites was being evacuated. He didn't particularly have a lot of patients there, but we put a call out to say, is there anyone available to come and help with this evacuation for this long-term care? And he put his hand up. He's like, yep, I'll be there in an hour. Showed up, provided primary care to really distressed and sometimes confused people who didn't know what was going on, who were going to be airlifted to the lower mainland, some who'd never been on flights before. And in his kind, gentle way, just held their hands, loaded them on the plane, sat with them, provided meds, people he'd never met before, ensured med recs were done so the pharmacy on the receiving end could do it, signed off all the things that needed to get signed off so the nurses could keep doing what they're doing in flight, and then flew back and then continued on his job.
Wow.
And I just thought, we didn't know this was going to happen. We didn't know that we needed this care. We didn't know it was going to happen when we put the call out. But there's Ed showing up and doing it.
What's Ed? Let's give Ed the last name.
He'll be so embarrassed. So Dr. Ed Sheehan, he works in West Kelowna.
Amazing.
He is, and he, I would say, is typical. He's not atypical.
No.
These are the stories that I see every day. So when I think why do I keep doing it? Well, because there are people doing much harder and much more creative things. And if my only job is to remove barriers so they can do it, great. I got the easy stuff and it's pretty fun.
Well, you're doing a great job. I'm sure they're very grateful for you. I'm curious, Beth, thinking back to 11-year-old Beth and Beth today, what has changed maybe in terms of your definition of health or health care over the years? I think as a kid, I really thought healthcare was like what you got from somebody, oh, I'm going to go and get this thing from my doctor. Yeah.
And in retrospect, that was really about
you receive
illness care.
Yeah. Yeah.
And I think over the last few years, what I've recognized is that healthcare is actually the things that happen outside of a healthcare setting. It's the things that prevent you from having to go. It's like taking your walk every day and drinking your water and getting sleep and having people that you love around you and loving people back and creating community and developing relationships. Like those things, those social determinants are what actually keep me healthy. And when there's stress or pressure on that and I become unhealthy, that's when I receive access to sickness care. But health care is the stuff that happens outside of that. And I really see primary care as focusing on that health maintenance rather than illness care. It's the preventative and the responsive side of it. And I'm like, I'd mentioned earlier, I worked in acute care for about 18 months. And I realized I don't like this because this isn't where people live. Like, I really prefer to work in a space where people live and you know, that's where their lives are. Yeah. And so I think if I look back as a kid, that wasn't on my radar. That wasn't like an idea that this is how you could work. And I'm happy I found myself here.
Did you ever think you'd be working with doctors?
No. And even when I started this job, because I've always worked in healthcare, but this is a pretty healthcare adjacent job that I'm in now. You know, it feels like something that I should be intimidated by, but you get to know folks and you're like, oh, these are just normal. Doctors are normal people.
Totally.
And they're just tend to be smarter than me.
Yeah. Yeah. It's just so funny. Like when you think about, when I asked you that question, I sort of zoomed myself back to like 11-year-old Shauna, and like I think we all as children put doctors on a bit of a pedestal, you know, and there's a little bit untouchable. And like you said, and we work with doctors here all the time. And now we know that they're totally just like you and me. Right. But like, I love what you said at the beginning about how people get into healthcare because they care, you know, and, I don't know if that was a relationship I necessarily thought about when, you know, I thought about doctors, especially my primary care provider when I was younger. Yeah. He was just like this old man that was kind of nice, but like
also scary.
Yeah. A little bit scary. Yeah. And I appreciate the work that you're doing to try to bridge that.
Oh, thank you. It's great work.
Yeah. Okay. So as a wrap, I have some questions that are a little bit different.
Okay.
So obviously we feel very clever on the Wealthy Podcast because our name is like, you know, health is wealth. And as you've just so eloquently outlined, there's more to health than just fix my boo-boo or I feel nauseous. So I'm curious for you, what areas of your health do you feel wealthy or abundant?
My relationships. I really feel, and so when we moved here, I knew nobody. Like my partner had a few friends in the community, but we kind of moved blind. And my community has developed because of my job. Like those are my friends. They're my colleagues. They're my peers. And I feel so loved by having this group of people in my life, and I feel like that's what also keeps me healthy. It keeps me mentally well to have good people to do hard work with. It keeps me physically well because I gotta keep going to work. And you know, before we moved here, I never wanted kids. And then I had we moved here and we're like, oh, this is why people have kids. This is a beautiful place to live and work. Yeah. And so I think of my family and my friends and the people that I surround myself with, and I feel overwhelmingly grateful for that. And that is what keeps me feeling healthy and wealthy.
Yeah, I love that. Do you know that I've asked that question to, oh boy, how many episodes are we in now? 33. And it's pretty much the same themes. It's always back to relationships.
Yeah. People matter.
People do matter. Yeah. More than we give them credit for, I think. So if you could leave our listeners with one thing, what would it be?
You are powerful. I think as people who access primary care, we have an obligation to access in a smart way, but also we have power in that. And I meet people all too often who feel powerless, and I want to remind people like you have You have strength in how you do this. You have strength to do it well. And there's options for accessing care, even if you don't have a provider, that you can use. Again, as my favorite social work theorist has this phrase that says, maintain the rage, but use it wisely. And
back to rage.
Totally. It's a lifetime. And I that's what I want people to remember, is that when you're feeling rageful at the system, like, use it wisely, because the people in it are actually doing a good job. But the system, like, we can work together to adjust this and to shift it.
Yeah. And no one's going to do it for you. That was, I love that you are leaving our listeners with that. And everybody out there, I just hope you hear that, like, really hear it. You know, we hear a lot these days, well, you have power, you can do that. But like, actually you do. And that was one of my biggest learnings. I had breast cancer in 2019, and I felt when you all of a sudden are facing a healthcare situation or a crisis, you do feel so dependent. You feel so powerless. Like you're at the mercy of the system, but you're not. We're not. And I think that's such a powerful takeaway. Well, this was a great conversation.
Thank you so much.
It was really lovely to have you. And thank you for shedding light on a really underrepresented area of healthcare, I think, sometimes in these conversations, because it's not, emergency room care is sort of like in a box. You kind of get it.
Yeah.
Right. Whereas this primary care,
it's nebulous.
It doesn't have defined borders.
That's right.
But it's so, so vital. To our health and
it's
well-being.
like water. It goes everywhere and we all need it.
It's like water. Thank you, Beth.
Thank you so much. This was wonderful.
It was so good to have you.
Oh, lovely.